Hello, my name is Nick Shotkoski, and I'm a senior in the AIM program covering domestic healthcare. Today I will be presenting Silk Road Medical, ticker SILK. Silk Road Medical Inc. develops and manufactures medical devices that allow for the treatment of carotid artery disease through the transcarotid artery revascularization procedure, or TCAR for short. TCAR is a minimally invasive preventative procedure that is clinically proven to reduce stroke incidence and is a safer alternative to the current standard of care procedures. TCAR is made possible by Silk Road's patented en route NPS product, which reverses blood flow during the procedure to redirect embolic debris away from the brain and through a filtration system. This embolic debris has been linked to increased stroke risk, dementia, and general cognitive decline. Silk Road holds patents and regulatory approval in the United States and abroad, but currently generates all of their revenue domestically. Silk Road Medical was founded in 2007 and is headquartered in Sunnyvale, California. So now I'm going to talk a little bit about carotid artery disease. Carotid artery disease is the progressive buildup of plaque in the carotid arteries, which are responsible for supplying the brain with blood and oxygen. This blockage restricts blood flow to the brain, creating an increased risk of ischemic stroke, as well as an increased risk of embolic stroke, in which plaque breaks from the artery and lodges in the brain. Strokes are the fifth leading cause of death in the United States, and it is estimated that 33% of ischemic strokes are caused by carotid artery disease. The disease affects roughly 4.3 million people in the U.S., with 453,000 patients being diagnosed and 179,000 procedures performed in 2019. This means only 39.3% of patients receive a procedure due to the riskiness of current standard of care procedures. This creates a critically undertreated market. Speaking of those current procedures, there are currently 3 used to treat carotid artery disease: carotid endarterectomy, or CEA, carotid artery stenting, or CAS, and TCAR. CEA was developed in the 1950s and is the current standard of care, representing 83% of procedure volumes in 2019. It is an invasive procedure requiring a large incision in the neck through which the surgeon removes problematic plaque. The procedure carries a high risk of adverse events, primarily revolving around heart attacks, cranial nerve damage, and infection. It is an extremely difficult procedure to perform, although it does do a decent job of reducing stroke risk. As it is an invasive procedure, it has higher procedural times and recovery times than its minimally invasive peers. CAS was developed as a minimally invasive alternative to CEA in the 1990s, but has failed to catch on due to the inherent dangers of the procedure. The placing of the stent in a minimally invasive procedure has a high risk of dislodging plaque, which can embolize and break free into the bloodstream. This is particularly problematic for this procedure because of the carotid artery's proximity to the brain. Any large emboli will cause a stroke, as they will go directly into the brain, and the smaller microemboli will lead to cognitive decline and dementia. As a result, the procedure nearly doubles a patient's 30-day stroke risk. And finally, there's TCAR. TCAR was first developed in 2012 and became commercially viable in 2015. The procedure is minimally invasive and involves a 2 to 3 centimeter incision above the collarbone to access the carotid artery. Silk Road's en route NPS product is attached to the artery and reconnected to a vein in the patient's waist. Blood flow is then directed through the device while the stent is placed away from the brain. During this process, embolic debris is filtered out through the en route NPS product to remove it from the body, and this allows for a much safer procedure to take place and protects the brain. This procedure takes less time, has a much shorter recovery time, and leads to a 52% reduction of 30-day stroke risk, heart attack, and death when compared to CEA. Silk's blood flow reversal technology is patented through 2030. Now onto the recommendation. These carotid artery procedures represent a total addressable market of $1.1 billion for Silk. With the option of a safer procedure available, it is likely that the percentage of patients receiving a procedure, which is currently 39.3%, would increase and expand the market. TCAR's safety and efficacy profile as well as the benefits of being minimally invasive, have it poised to become the standard of care in treating carotid artery disease. Silk's blood flow reversal technology also has significant potential in other therapeutic areas such as brain, aortic arch, and heart, although these were not factored into the valuation due to lack of pipeline visibility. There is also a large market opportunity in the aging populations of Europe and Japan, although these were not factored into the valuation either. The company has patents and regulatory approval in these countries, but due to uncertainty over the outlook, they were not included in the financial projections. Due to the popularity of minimally invasive procedures, the reduction of costs to the U.S. healthcare system, and the aging population of the United States, it is recommended that Silk Road Medical be added to the AIM Small Cap Fund at a price of $77.55, representing an upside of 28.2%. So now on to my first driver. My first driver is the popularity of minimally invasive procedures in vascular surgery. Since the 1990s, minimally invasive procedures have become the standard of care in nearly all vascular procedures, representing about 70 to 85% of vascular procedure volume for a given treatment area. Minimally invasive procedures are the standard of care for nearly all vascular surgeries as they are less demanding on the body, allow for shorter recovery periods, and lead to less complications. Despite all these benefits, until the development of the en route MPS reversal system, carotid artery procedures were the only vascular procedure for which there was not a viable minimally invasive procedure available. Now that this minimally invasive procedure exists, it seems likely that the standard of care for carotid artery procedures will follow suit and shift to the minimally invasive alternative. Studies have shown that TCAR leads to an 87% lower chance of cranial nerve damage and a 52% lower chance of 30-day stroke, death, and heart attack when compared to CEA. As 83% of the 179,000 procedures performed are CEA, or were CEA in 2019. This creates a large runway for long-term growth. Now on to the second driver, reduction of cost to the healthcare system. One of the key benefits of minimally invasive procedures like TCAR is that they are more cost-effective than invasive procedures. This is primarily due to the decreased procedure time and recovery time of these surgeries. Recent CRASH trial data showed that the average CEA procedure took 171 minutes to complete, compared to 45 to 90 minutes for TCAR. This time tends to go down as physicians perform more TCAR procedures and become more experienced. In addition to this, TCAR has been shown to have a 26% lower chance of the patient remaining in the hospital more than one day. This is critical because it is estimated that it costs more than $10,000 per day to keep a patient in a hospital. TCAR can also be performed under local anesthesia, which is less expensive and leads to far less adverse events than general anesthesia. Studies have also shown that the average patient's length of stay under TCAR is 1.7 days compared to 3 days for CEA. In addition, strokes cost the U.S. more than $36.7 billion annually, according to the AHA, creating an economic incentive to help prevent strokes before they happen. Now on to the third driver, the graying of America. One of the key risk factors for carotid artery disease is age. As the body ages, arteries become less flexible and more prone to plaque buildup. As a result of this, the vast majority of patients, over 80%, receiving carotid revascularization procedures happen to be over 65. This population segment is poised to explode as the baby boomer generation continues to age into the demographic through 2030. The elderly population is expected to grow from 46 million to 64 million by 2030. This demographic shift will create an increased need for carotid revascularization procedures and expand the company's total addressable market at a 3.4% CAGR through 2030. Now onto the valuation. In order to reach an intrinsic value for Silk, a 10-year DCF model was constructed. Using a terminal growth rate of 2% and a WACC of 7.99%, an intrinsic value of $79.29 was reached. I have the company becoming profitable in 2022 and the ROIC becoming greater than the WACC in 2023. Additionally, a last 12-month EV to sales multiple valuation was calculated. Utilizing a blended average EV to sales multiple of 32.5 resulted in a relative value of $70.60. By weighing the models 80/20, a price target of $77.55 was reached, resulting in a 28.2% potential upside from Wednesday's close. Now onto the risks. My first risk is that the displacement of legacy procedures may be difficult. Vascular surgeons are well experienced in performing CEA procedures and may be hesitant to shift to a new method. The second risk is the risk of innovative new procedures. And the final risk is surgical risk. Vascular surgeries inherently carry high risks of adverse events such as embolization, bleeding, heart attack, and stroke. This is especially true for carotid artery procedures due to the proximity to the brain. And finally, on to management. Erica Rogers is the president and CEO of Silk Road Medical and has been in the position since 2012. Lucas Buchanan has served as the company's CFO since 2016. Thank you for listening to this presentation, and feel free to reach out with any questions. And I look forward to seeing you guys for the Q&A on Friday. Thank you.